Hi everyone, today I will be discussing and demonstrating on the abdominal palpation. So abdominal palpation or abdominal assessment is a part of antenatal care or antenatal assessment where we are going to see or examine the abdomen of the pregnant mother. So before doing the palpation, we have to get ready with the articles, and then we have to do some preliminary assessment, like we have to take consent from the mother, we have to ask the mother to go and empty the bladder so that no disturbance should be there during the examination, and the mother should feel comfortable. Privacy should be provided so that privacy is provided for the mother. And the most important thing which we have to keep in mind is that only the part which we are going to examine, we have to expose the necessary needed part. We should not expose much so that we maintain the privacy of the patient. And inspection, palpation and auscultation. So for inspection, we'll expose the needed area, and then when we inspect, we have to inspect the shape of the abdomen, the contour, then the color, the skin changes we have to see in the inspection, like whether linea nigra, striae gravidarum, or whether the shape of the abdomen is oblique or ovoid or rounded. So all these things we have to see in the inspection. And in the inspection we need to measure the abdominal girth as well as fundal height. So in measuring the fundal height, we have two different methods, that is instep method and finger method. So now I'll be showing you the instep method. So for doing this instep method, first we have to palpate the abdomen of the mother, and after feeling the heart from surface, which indicates the fundus, just after the Ziffy sternum, we have to palpate, and then after that we have to take the instep and we have to measure the fundal height. So for measuring the fundal height, we have to keep the instep in between our fingers, and we have to measure in the middle line of the umbilicus till the symphysis pubis. So that indicates the gestational age of the mother. And another method is the finger method, where we are going to measure, we are going to feel the abdominal fundus, and from the umbilicus, just above the umbilicus, we have to measure by putting our fingers. So that is the finger method. And in the inspection itself, we have to measure the abdominal girth too, where we are going to insert our inch tape under the mother, and then we have to encircle and bring to the midline of the umbilicus, and then we'll be measuring the fundal height, abdominal girth. So like this we have to measure the abdominal girth. So this is regarding the abdominal girth. The normal abdominal girth of a pregnant full-term lady is 100, but sometimes it may vary because of multiple pregnancy, or maybe in case of polyhydramnios, so it can vary. So that is regarding the inspection. Next is the palpation. Before doing palpation, we should always keep in mind that we have to warm our hand first, and then we have to explain them that we are going to palpate. If she is feeling any pain or any uncomfortable, she have to report to us. After warming our hand, we have to feel the fundus, and then we have to palpate with the pads of our fingers, and then we have to feel whether there is any emptiness or multiple lobes present there, or any heart mass which is present there. So the inference which we can find here is that if there is emptiness and multiple mass are present, then it may be indicating of the extremities, or if this heart globular mass, it may be indicating of the fetal head, or if this broad, then it may be indicating of the bridge or the buttocks which is present in the upper pole of the fundus. Then next, slowly, without leaving our hand, always we have to keep in mind, once we have put our hand on the abdomen of the mother, we should not lift it. So after that, we'll slowly bring down to the downwards, and next step is the lateral grip. So if we do the right lateral grip, we have to push the contents of the left side towards the right side, and we have to feel with the finger pads, and then we have to see whether it's empty or any broad mass are present or not. So if this empty with the multiple lobes, then it's indicating of the extremities in the right side. Then next, we have to again push the right side content to the left side, and in the left side we have to palpate it. So when we palpate, if we find a broad curved surface, it's indicating the spine. Then slowly, without leaving our hand, again we have to slowly rotate our hand and our head facing towards the foot end of the mother. And next is the pelvic grip, where we are going to put our two hands and fingers together, and we have to see whether it's divergent or convergent. So now if it is convergent, that means the two fingertips are touching each other. It indicates that it is not engaged, the fetal head had not engaged yet. And if it is convergent, that means something is obstructing your fingers, so that means the fetal head has already engaged and merged inside the true pelvis. Then the last step in the grip is the Pauli grip, where again slowly you will bring back the left hand and put on the abdomen firmly. And then with the left hand we have to feel the lower portion of the symphysis pubis, that is the lower pole of the abdomen. We have to grasp it and we have to try for ballotment. So ballotment is nothing but movable. So here whether we have to find out whether the engaged part is movable, ballotable or not. If it is movable or ballotable, it indicates that it has not engaged yet. But if it is fixed and if it is not movable, that indicates it has already engaged. So that is regarding the palpation of the abdomen. Then the last one is the auscultation. So in auscultation, we can either use stethoscope or we can use fetoscope. So even fetoscope also we need to pre-warm it, and we have to listen the fetal heart sound. So for listening the fetal heart sound, we can draw an imaginary line between an oblique imaginary line between the umbilicus and the inguinal line, and just for approximation we can find out where is the spine. Then after that, the side towards where there is spine, we have to put in the middle line of the imaginary line, and we have to listen with our ear, and we have to count our watch, so for 1 minute. So the normal fetal heart rate is 140 to 160 beats per minute, or either we can use stethoscope method too. So this is regarding the auscultation. So the inferences which we can find from doing this abdominal examination is the light, the position, then the presenting part, and if there is any complications or if there is any early diagnosis to be done, we can find out through doing this abdominal examination of antenatal care. Thank you.